Learning to drink water through that syringe was the worst thing. My first night of after double jaw surgery, I spent it in the hospital. You know, they put you in the ICU because it's a very invasive surgery. They want to monitor you, make sure nothing goes wrong. And it's really important to hydrate, but because my jaw was bandaged shut, I wasn't able to open, close. My lips were like gonna get really swollen. I had no sensation. My whole face just felt like a mask. And so I couldn't drink water like a normal person, like using a glass. It just didn't work. So what you have to do is you have to drink through a syringe. And what that means is they give you this plastic syringe, and at the end of it is a floppy straw, like a thin floppy straw. And so you suck water into that syringe, and then you push the little straw into the side of your mouth, in between your lip and your gum and your teeth. So you kind of push it into the back of your teeth. It's hard to do that because you're swollen. I'm still swollen, as you can see. I'm 30 days out from jaw surgery. And then you slowly push squeeze the syringe, and then water comes little by little into the back of your mouth. And swallowing is hard too, because it's just a very different sensation than you're used to. Your tongue is in a different position. You just feel really delicate. And so it's kind of a scary thing. Also, it's, you know, I didn't want to cough, not that I wanted to, not that I needed to, but I didn't want to cough. Obviously didn't want to throw up, didn't want to have a coughing fit, you know, from water going down the wrong pipe. So it's kind of a scary situation because you don't want anything to go wrong after having this dramatic kind of surgery. So yeah, learning to drink water was a tough one, but it's really important to hydrate because you have to keep a certain amount of volume in your body to just not feel nauseous, to allow your body to have that water so that it can, you know, begin the healing process. So very important part of double jaw surgery healing, but also one really tough thing. Seems really simple, but it was really tough when I was going through it. And I think day one was a lot of learning, a lot of numbness, a lot of learning, and a little bit of fear of the unknown. All right, my fellow blueberries, you're all puffed up, going through this surgery, or you're about to go through this surgery. Hang in there, you will get through this together. And you know, be strong. A lot of people have gone through it. You'll be all right.